Hello everyone, welcome back to my channel. Today we are going to discuss Oman prometric questions. This is part 3. Okay. Now question number 1. The nurse is caring for a patient who had major abdominal surgery under general anesthetic 4 hours ago. An appropriate goal for the patient including options. Option A, having minimal fine crackles in the base of the lungs using a incentive spirometry every 4 hours. Option B, expectorating minimal amount of secretions. Option C, performing coughing. Option D, exercise every 1 hour while walking. Option D, exercise every 1 hour while walking is correct. Question number 2. When teaching a community class on cerebrovascular accidents, stroke, which of the following should participate of the class? No at the completion of the class. Option A, muscle and alignment damage is not reversible. Option B, expressive aphasia is resolved by voice test. Option C, there is a risk of mood disorders such as depression. Option D, liquid should be consumed at the same time as solid food. Option D is correct. Question number 3. A community health care nurse visits a patient who had cerebrovascular accident. The patient is at the risk for deficiency volume due to voluntary reduction intake of fluid intake to avoid the use of bathroom. The nurse educates the patient on the importance of drinking fluid and maintaining hydration. Which of the following indicates the efficacy of the nursing intervention? Option amber color urine. Option B, respiration of 35. Option C, tachycardia. Option D, moist mucosa membrane. Option A, amber color urine is correct. Question number 4. A home health nurse has entered the home to complete an admission assessment and a patient who has a methicillin resistant staphylococcus aureus, that means MRSA, urinary tract infection. The patient will receive intravenous anti-infective via a peripherally inserted central catheter for 3 weeks. Which of the following actions should the nurse take first? Option: shake the patient's hand. Option B, place the nursing supply bag on clean dry surface. Option C, obtain the patient written consent for home health care. Option D, perform hand hygiene as per agency protocol. Option D is correct. Question number 5. A 16-year-old patient presented to the clinic requesting birth control with the diagnosis of health seekers behavior. The best goal have the patient. Option A, verbalizing understanding of safe sex practice and following safe sexual practice in all encounters. Not Option B, not engaging in sexual encounter until she is over 18 years old and maintaining a healthy lifestyle. Option C, recognizing the signs of pregnancy and the symptoms of sexually transmitted disease. Option D, understanding safe sexual practice and use a condom to prevent pregnancy and sexually transmitted disease. Option D is correct. Question number 6. A nurse plans to teach a group of 20 to 25-year-old women about oral contraceptives. The nurse should instruct that oral contraceptives may options. Option A increases the risk of pelvic inflammatory disease. Option B cause acne to worsen. Option C decreases the risk of breast and cervical cancer. Option D is decreases the risk of endometriosis. Option A is correct. Question number 7. The nurse administered a dose of morphine sulfate as prescribed to the patient who is the post anesthesia care unit. The patient appears to be resting comfortably. The respiratory rate is 8 and the saturation is 21. Oxygen via cannula is 86%. The nurse should administer immediately. Option A flumazenil, option B midazolam, option C naloxone, option D androstenedione. Option C naloxone is correct. Question number 8. When conducting discharge teaching for the parents of a child newly diagnosed with cystic fibrosis, which of the following statement by the parents indicate the need for further teaching? Option A. Weekly weight helps evaluate effectiveness of nutritional intervention. Option B. Weekly weight helps the doctor to know if my child is absorbing nutrition. Option C. Weekly weight reassure my child that recovery is progressing. Option D. Weekly weight helps the doctor to know if my child needs additional enzymes. Option D is correct. Question number 9. A patient is diagnosed with pulmonary hypertension. Which of the following nursing diagnosis should be the priority? Option A. Impaired gas exchange related to altered blood flow secondary to pulmonary capillary construction. Option B. Fatigue related to hypoxia. Option C. Anxiety related to illness and loss of control. Option D is activity intolerance related to imbalance between oxygen supply and demand due to right and left ventricular failure. Option D is correct. Question number 10. While caring for a patient in the post anesthesia care unit who has developed hypovolemic shock, a nurse should position the patient in option A. Flat with leg elevated. Option B. In the Trendelenburg position. Option C. With the head of the bed elevated 45 degrees. Option D. Completely flat. Option B. Trendelenburg position is correct. Thank you for watching the video. If you want more videos, please subscribe and share, and if you have any comments, please comment it down. Thank you.